When choosing the right phone for the patient, it's important to look at what the client is capable of. We have some very young, modern patients that look at Bluetooth telephones like the Gigaset, and some of our older patients, because their eyesight isn't so good and their fingers aren't so, able, we go for something more like this piece of equipment. Now, this telephone, as you can see, has got large buttons, but what's really important about it is that you can increase the tone, you can increase the volume, it's got an amplify button, and it's got a hands-free. The beauty of this is also the fact that it's got a flashing light and also a telecoil inside it. So this will cover every eventuality for somebody who wears a hearing aid. So if we now pop this down, I'm going to demonstrate the correct positioning to use with a hearing aid. I'm going to ask Tyler to pick the phone up and put it to her ear. Now, when you don't wear a hearing aid, that's absolutely to do it that way. But if you've got an in-the-ear hearing aid, there's a slight modification you'll need to make. And that is to just gently turn the phone away from the ear, and that will allow the sound to pass through the telephone into the hearing aid without causing feedback. However, if it's a behind-the-ear hearing aid, you would take the phone up to the ear, possibly take it the other direction and go 1/2 inch to 1 inch above the ear to allow the sound to go into the microphone above the ear. And that's how to use a phone with an in the ear and the behind the ear hearing aid.